بسم الله الرحمن الرحيم. المحاضرة بعنوان Diseases of the Kidney. أول مرض نتعرف عليه من أمراض الكلية هو النفروسيس. Definition of nephrosis. Nephrosis includes degenerative and inflammatory lesions primarily affecting the renal tubules. Nephrosis is the most common cause of acute kidney failure and or uremia. Toxic nephrosis. The kidney are susceptible to endogenous السموم الداخلية والخارجية and exogenous toxin from blood and during renal excretion. أما بالنسبة إلى المسببات فتشمل الآتي: direct action of metal toxins such as mercury, زئبق, arsenic, cadmium, selenium, and organic copper compounds. Number 2, oral administration of potassium, dichromate, and mercurid chloride includes topical blistering agents containing mercury chloride. And number 3, antimicrobials like aminoglycosides and overdosing with neomycin مضاد الحيوي neomycin and gentamicin in the treatment of calves. Number 4, prolonged treatment with or overdosing جرعة عالية من الsulfonamides, turpentine oil, benzene midazole compounds, thibendazole. Number 5, overdosing with vitamin K, D2, D3 injection in horses. Number 6, also from the causes, treatment of horses with non-steroidal anti-inflammatory drugs such as phenylbutazone and flunixin, milgaumin, monensin in ruminants, oxalate in plants, and mycotoxin. The pathogenesis of nephrosis include the following points. In acute nephrosis في حالة النفروسيس الحاد there is obstruction هنالك إغلاق to the flow of the glomerular filtrate through the tubules or a result of interstitial edema and intraruminal cast. If there is sufficient tubular damage, there may be back leakage of glomerular filtrate into the interstitial. There may be also direct toxic effects on glomeruli, which decreases glomerular infiltration. Then both effects, the combined effects is oliguria and uremia. راح تسبب لنا قلة بإنتاج اليورين مع يوريميا، يعني تواجد اليوريا في الدم. In subacute cases في الحالات تحت الحادة راح يصير هنالك impaired tubular resorption، راح يصير إعاقة في امتصاص الأنابيب of solutes and fluids may lead to polyuria. Many diseases or systemic disease such as septicemia cause temporary tubular nephrosis. The clinical signs or findings include the following: may not be referable to the urinary system. Per acute cases, in vitamin K3 injection there may be colic and stranguria. حيصير هنالك مغص مع حسق في التبول. In acute nephrosis, there is depression, anorexia, hypothermia, a slow or an elevated heart rate, pulse, diarrhea, later on dehydration occurs. وفي المراحل الأخيرة تحدث الجفاف. أما بالنسبة إلى الكلينيكال باثولوجي أو التشخيص المختبري فيعتمد على الآتي: أخذ عينة من اليورين، نشاهد وجود presence of proteinuria, leukosuria, and hematuria والتي سبق أن أشرت إليها بالمحاضرات السابقة من ضمن التغيرات التي تحدث في اليورين. Elevation of gamma glutamyl transferase in urine, elevation of SUN and creatinine although hypoproteinemia may be present. وفي الحالات الحادة acute renal disease of horses hypercalcemia زيادة أو ارتفاع في الكالسيوم and hypophosphatemia may be present but in vitamin D intoxication serum's calcium and phosphates are increased. Isotemia occurs when uremia is present. أما بالنسبة للنكروبسي finding فنلاحظ الآتي: kidney are swollen متضخمة and weight in acute cases, necrosis and desquamation of tubular epithelial and highly cast in the dilated tubules, renal medullary necrosis in phenylbutazone poisoning, ulcer in all or any part of the alimentary tracts. أما بالنسبة إلى العلاج treatment والذي سبق أن تطرقنا له بصورة general principle of treatment of urinary system. Number 1 specific antitoxin، يعني يجب أن نعرف ما هو المسبب الرئيسي لحدوث النفروسيس، فننطي الانتيتوكسين الخاص with the treatment of the real cause. Renal and hepatic wash using 10 إلى 25% IV glucose. Purgative to get rid of GIT toxin. ننطي المواد المسهلة القوية حتى نطرد جميع المواد السامة من القناة الهضمية. Treatment the complications such as diarrhea and uremia. المرض الثاني اللي ناخذه من أمراض الكلية أو الكدني renal ischemia. Definition: it is a reduction of blood flow through the kidney due to general circulatory failure causing a transitory oliguria followed by anuria and uremia if the circulatory failure is not corrected. Etiology: any condition of hypotension or release of endogenous process agent. أما بالنسبة للمسببات of acute renal ischemia: Number 1 general circulatory emergency such as shock حالات الصدمة، diarrhea التي تسبب حدوث الجفاف dehydration، acute hemorrhagic anemia، heart failure وقصور القلب، embolism of renal artery recorded in horses، extreme ruminal distension in cattle. أما بالنسبة للمسببات المزمنة Etiology of chronic renal ischemia, chronic circulatory insufficiency such as chronic heart failure والتي سبق أن تطرقنا لها في أمراض congestive heart failure. Pathogenesis: as blood pressure falls هنالك انخفاض في ضغط الدم. Sudden reduction in cardiac output occurs led to compensatory vasoconstriction، فراح يصير تقلص في الأوعية الدموية of renal blood vessels and consequently ويعقبها بعد ذلك acute ischemia. Glomerular infiltration decrease يقل and metabolites that are normally excreted accumulate in the bloodstream. The concentration of urea in the blood increases, giving rise to pre-renal uremia. Clinical findings: renal ischemia does not appear as a distinct disease and its signs are associated with the primary disease. Oliguria and isotemia, later on acute renal failure and uremia may occur. Clinical pathology: proteinuria as well as elevation of SUN and creatinine. Necropsy findings: renal cortex is pale and swollen، تكون شاحبة وتكون متضخمة قشرة الكلية. Necrosis is visible at the corticomedullary junction. Necrosis of tubular epithelium glomeruli in severe cases. And hemoglobinuria and myoglobinuria, hyaline cast, are present in the tubules. أما بالنسبة إلى الدايجنوسيس أو التشخيص فيعتمد لنا على السيمتومز including oliguria قلة في إنتاج اليورين, azotemia and the presence of circulatory failures. بالنسبة للعلاج treatment correcting أهم نقطة في هذا المرض علاجه هو correcting the fluid electrolytes and acid-base balance disturbance. Supportive treatment with the treatment of the real cause, treatment of acute renal failure. المرض الثالث اللي راح ناخذه بالنسبة لأمراض الكلية هي glomerular nephritis. It occurs as a primary diseases or as component of disease affecting several body systems such as equine infectious anemia. It affects the renal glomeruli, although the inflammatory process extended to affect surrounding interstitial tissue and blood vessels. It is rare in ruminants. أما بالنسبة للأمراضية أو الباثوجينيسيس glomerular injury circulating antigen-antibody complex خاصة equine infectious anemia، يعني راح تكون إلها علاقة بالاميونيتي والعلاقة بين تكون أجسام مضادة وأنتيجين وأنتيبودي may be deposited in the glomerulus. أما بالنسبة للsymptoms and diagnosis they depend on the primary causes. Many affected animals are asymptomatic until found dead، يعني مباشرة نلقى الحيوان بدون أعراض سريرية، نلقى الحيوان ميت. Some have signs of tachycardia, edema of the conjunctiva, nystagmus, walking in circles and convulsion. There is severe proteinuria and low plasma albumin. Blood urea is increased in lamb greater than 35 mmol لكل لتر with hyperphosphatemia and hypocalcemia. At postmortem, the kidney are large and pale and have multifocal pinpoint yellow and red spots throughout the cortex. On histopathological examination, there are severe vascular lesions in the choroid plexus and the lateral ventricles of the brain. Interstitial nephritis. Number one, it is rarely recognized in animals. It is seen in post-mortem finding. إذن المرض الرابع اللي راح أيضا نواجهه من ضمن الحالات السريرية هي الانترستيشال نفرايتس. It is rarely recognized in animal. ممكن أن نشوفها فقط بحالات من جري تشريح للحيوان. It may be diffuse or have focal distribution in calves, white spotted kidney due to destruction of nephrons. The kidney is an important reservoir for leptospira, especially particularly cattle. The disease began with acute tubular nephrosis. Horses with chronic interstitial nephritis have the clinical syndromes of chronic renal failure with uremia. Embolic nephritis. Clinical signs occur when embolic lesions are very extensive, in which septicemia may be followed by uremia as well as transient proteinuria and pyuria. مسببات الأمبوليك nephritis septicemia or bacteremia. مثال على ذلك أحيانا يصير عندنا E. coli infection فتصير عندنا بكتيريميا، أو أحيانا ال E. coli تفرز لنا الاندوتوكسين وتسبب لنا septicemia. فالبكتيريا ممكن أن تتوقف أو تنحشر في أحد الرينال تشو lead to embolic suppurative nephritis or renal abscesses. Localized septic process from valvular endocarditis, suppurative lesion in uterus, other navel, peritoneal cavity in cattle, be associated with systemic infections such as septicemia in neonatal animals, including shigellosis in foals and E. coli septicemia in calves, erysipelas in pigs, septicemia or bacteremic strangles in horses. Pathogenesis. Bacterial emboli localized in renal tissue and causing focal suppurative lesion. Emboli can be block larger vessels and causes infarction of portion of kidneys. Presence of proteinuria, cast and microscopical hematuria. The gradual enlargement of focal embolic lesions leads to toxemia and the gradual loss of renal function. Clinical signs usually develop only when multiple emboli destroy much of the renal parenchyma or when there is one or larger infected infarcts. Clinical findings, signs of toxemia. The kidney may be enlarged or rectal examination, repeated showers or emboli or gradual spread from several large suppurative infarcts may cause fatal uremia. Spread to the renal bulbus may cause signs similar to pyelonephritis. Clinical pathology, hematuria and pyuria. Proteinuria is present but is also normally present in neonatal animals in the first 30-40 hours of life. Culture of urine at this time when proteinuria occurs may reveal the identity of the bacteria infecting the humulus. Hematology reveals acute or chronic inflammatory process. بالنسبة للنكروبسي finding تتضمن small gray spots in the renal cortex in early stage, large abscesses خراجات كبيرة in later stage may be extending into pelvis. Fibrous tissue may surrounding long-standing and healed lesion consist of areas of scar tissue cortex causing this depressed surface due to destruction of cortical tissue. Extensive scarring may cause an obvious irregular reduction in the size of the kidney. Differential diagnosis: pyelonephritis, pre-renal uremia and ischemic tubular nephrosis in severely dehydrated neonatal animals. The presence of other signs of sepsis can reveal the presence of embolic nephritis. The sudden acute abdominal pain in renal disease suggests acute intestinal obstruction, but defecation is not affected and rectal examination of intestine is negative. Treatment: treat the real cause. Always we say we have to treat the real cause. المسبب الرئيسي with renal wash and antiseptics. Antimicrobials after urine culture if the causative agent is bacteria, and we should do the sensitivity test for antibiotic. It should be continued for long periods, 7 to 14 days, especially for urinary tract infection. More, avoid the use of nephrotoxic drugs. Treatment the septic shock in neonatal animals. أما بالنسبة إلى المرض الآخر وهو البايلونفرايتس فنتعرف على التعريفة. Pyelonephritis, it is a suppurative infection of kidney caused by ascending infection from the lower urinary tract. It is characterized by enlarged kidney, pyuria, suppurative nephritis, cystitis and urethritis, as well as abnormal urine content التي سبق أن شرحناها بالمحاضرات السابقة. مسببات الاتيولوجي: secondary to bacterial infection of the lower urinary tract system, spread from embolic nephritis of hematological origin such as septicemia in cattle caused by Pseudomonas aeruginosa, specific pyelonephritis in cattle caused by Corynebacterium renale alone or mixed with Corynebacterium pyrisoma and C. cystitis. Pseudotuberculosis, actinomyces and actinobacillus equili, E. coli and Staph aureus. أما بالنسبة للأوكرنس فتعتمد أن it's widespread in all countries in cattle but rare in sheep. Cows are more susceptible than bulls. All ages of mature cows are susceptible. Source of infection: مصدر الإصابة urine of affected or carrier animals such as Corynebacterium renale, can also be isolated from vagina or vaginal vestibula of urinary tract of healthy or carrier animals. انتقال المرض transmission, infection can be transmitted by direct contact or by the use of contaminated brushes. Careless use of catheters, venereal, such as the organism was isolated from prepuce, urethra, and the semen of bulls. بالنسبة لعوامل الخطورة risk factors, it is more common in early lactation and rare in second lactation, cold region of the year, and heavily feed high producing dairy herds. It is low in cows that have post-parturient uterine disease that treated with antibiotics. Obstructive urinary abnormalities in bulls, techniques of or infection of urinary catheterization. Pathogenesis يعتمد على pyelonephritis, usually develops as an ascending infection from bladder, ureters, and kidney. A trauma to the urethra or urine stasis may facilitate ascending infection. The destruction of renal tissue, obstruction of urinary outflow, ultimately results in uremia, يؤدينا لحدوث اليوريميا, and the death of the animal. Corynebacterium renale, C. renale, have a greater ability, القابلية العظمى, to attach the urinary tract epithelium, are more resistant to phagocytosis, and make the initial ascending صاعد infection. هنالك descending وهنالك ascending infection. في هذه الحالة pyelonephritis هنالك ascending infection, التهاب صاعد. أما بالنسبة للclinical findings أو العلامات السريرية, the first signs may be passage of blood stained urine, دم البول المصحوب بالدم. In other cases, the first signs may be an attack of acute colic, rising of the tail and kicking at the abdomen, لأنه هنالك مرض شديد في الحيوان، لذلك راح يضرب على المنطقة اللي يعاني من عندها من المغص. and straining to urinate, صعوبة بالتبول. The attack passing off in a few hours due to obstruction of the ureter or renal calicus bypass or tissue debris. The illness is gradually with fluctuating temperature about 39.5 centigrade, decreases in appetite, loss of condition, and fall in milk production, yield over a period of weeks, presence of blood, pus, mucus, and tissue debris in the urine. تحليل اليورين راح يظهر لنا وجود القيح والدم والميوكس. dribbling يعني قطرات، ينزل البول على شكل قطرات والتي تكون مؤلمة painful urination. أما عندما نفحص الركتال بالبيشن فنلاحظ وجود enlargement بالكدني، تضخم بالكلية، loss of its labulation، خاصة في مثل ما ذكرنا بتشريح الكلية بالمحاضرة الأولى باليورينري سيستم، الكدني بالأبقار تكون labulated، فراح يصير loss of labulation and pain. Later on, thickening of a bladder wall and enlargement of one or more ureters, cord-like. In many cases, there is only weight loss and suspected gastrointestinal disease, so urine analysis is essential. Unless early treatment, the disease is highly fatal. The course is usually several weeks or even months, and the terminal signs are uremia, then death. Clinical pathology, urine analysis and examination, proteinuria and hematuria. البي اتش مال اليورين يكون أكثر من 8.5، يعني راح يكون قاعدي، اليورين راح يكون قاعدي. Higher specific gravity vary between 1.008 to 1.021. وإذا ما أخذنا عينة من اليورين وفحصناها بالميكروسكوب ممكن أن نشوف بايوريا وأحيانا ممكن أن نشاهد البكتيريا اليورين كلتشر واللي تكون جرام بوزيتيف. تشاينيز لايك لترز تكون شكل البكتيريا خاصة الكوراني بكتيريا رينالي شكلها مثل الأحرف الصينية. or Palissidia like cluster. Blood and serum contains مكونات بالنسبة للدم أو السيرم. إذا أخذنا عينة دم ممكن أن نلاحظ الآتي: hypoalbuminemia and hypergamaglobulinemia. نيوتروفيليا ارتفاع بعدد الخلايا الدموية البيضاء من نوع العضلات النيوتروفيل may be present. Elevation of serum creatinine and urea above 1.5 mg per dl and 100 mg per dl respectively. This mean bad prognosis, and renal biopsy and ultrasounds reveal dilated renal collecting system. Endoscopic examination reveals enlarged urethra and thick bladder. بالنسبة للنكروبسي finding, the kidney are usually enlarged and loss of lobulation. The renal calyx and enlarged uterus contain blood pus and mucus. Light colored necrotic areas on the kidney surface. Changes visible of the cut surface including excavation of papillae, abscessation and necrosis, which extended from the distal medulla into the cortex. The bladder and urethra are thick-walled and their mucous membrane are hemorrhagic, edematous and eroded. Histologically, the CGM, the renal lesion, are confusing mixture of acute suppurative changes and various degrees of fibrosis and with mononuclear cell infiltration. Differential diagnosis تشخيص التفريقي: acute colic and acute intestinal obstruction, normal kidney and urine. Chronic cases may be confused with traumatic reticulitis, normal kidney and urine. Sporadic cases of non-specific cystitis can only be differentiated by culture of the urine. Polypoid cystitis is a non-specific result of a bladder inflammation and may be caused of dysuria and obstructive uropathy. بالنسبة للعلاج: large doses of procaine penicillin. يجب أن نعطي في هذه الحالات جرعة عالية خاصة الانيشال دوز من بنسلين ولمدة ديليا يوميا ولمدة 3 أسابيع، لأنه كافة الأمراض الجهاز البولي تحتاج فترة طويلة من العلاج بالمضادات الحيوية. Monobasic sodium phosphates or sodium acid phosphates 125 ملغ dissolved in drinking water daily for several days to acidify urine، لأنه ذكرت لكم يكون pH 8.5 يعني يكون قاعدي، فلازم نحوله إلى acidifying urine حتى نمنع تكاثر البكتيريا. IV glucose, urinary lavage, urinary antiseptics, diuretics, sedatives, sufficient quantity of water, less nitrogenous food. Improvement of appetite and milkweed and clearing of the urine indicate good prognosis. Control: isolation of affected animals and destruction of infected litter and bedding. Hygienic measures for parturation, cauterization, excess water intakes, vitamin A and C. آخر حالة مرضية ناخذها بأمراض الكدني وهي الهيدرونفروسيس يعني تجمع السوائل. It is dilatation of the renal bulbus with the progressive atrophy الضمور of the renal parenchyma. It occurs as congenital or an acquired condition following obstruction of the urinary tract. It causes any urinary tract obstruction, urethritis in ruminants يعني وجود الحصى. If the obstruction is unilateral, the unaffected kidney can compensate ممكن أن يتعوض عن الكلية المريضة fully for the loss of function, and the obstruction may not cause kidney failure إذا كانت unilateral obstruction may be detectable on palpation per rectum or a grossly distended kidney. Chronic partial obstruction of the renal urethra or by urolysis causes, hydronephrosis, and chronic renal failure in sterile. Papillomas of the urinary bladder causes partial obstruction of the urethra in cows. Symptoms, diagnosis, and treatment depend on the main cause. الحالة الأخيرة هي أن نشوفها ممكن أن بالكلية، وهي renal neoplasms. الأورام primary tumor of the kidney are uncommon، لكن ممكن أن تكون carcinoma occur in cattle and horses. Enlargement of the kidney is the characteristic signs in cattle and horses. Neoplasm should be considered in different diagnoses of the renal enlargement. Thank you very much.